During World War II, a corps of conscientious objectors across the United States chose to fulfill their obligation by performing civilian public service rather than serving in the military. These men, working without pay, were assigned by the government to work large projects. Some expressed a desire to perform more meaningful service and were assigned to help in state mental health institutions. What they saw were deplorable conditions. One example was the Philadelphia State Hospital, with a capacity of 2,500 patients and a census of 6,000. A staff of only 200 attendants worked at the facility. A May 1946 issue of Life magazine exposed the situation and described the mental hospitals as little more than concentration camps. Wards were so crowded that the floors could not be seen, and patients were naked and restrained with straps and locks. The Mennonite community rallied to the cause, and the church developed a vision of care for those with mental illness based on the theology of healing. A committee was created, and a master plan called for 3 locations throughout the country. The proposed eastern site was a 115-acre farm in Leitersburg, Maryland, that previously served as a CPS camp focused on soil conservation. A number of buildings already existed along a dirt lane that ran parallel to the small winding brook. The Leitersburg proposal was approved and the site was named Brook Lane Farm. A 23-bed hospital was built and the first patients were admitted in January 1949. During the first year, 107 total patients were admitted. The farmhouse served as both the dining and living room and included offices and 2 apartments for staff. The early staff was almost exclusively volunteers and conscientious objectors and lived on the farm. As the facility had a dual nature of psychiatric hospital and working farm, the staff and patients worked side by side, washing and ironing clothes, cooking, baking, cleaning, gardening, planting, and harvesting crops in the fields and completing construction and maintenance work.
I had never seen the inside of a mental hospital. I didn't know anything about mental hospitals. And so the first couple of months was like a wake-up call in terms of seeing the severity of the despair and horrible symptoms and depression and anxiety and psychosis that people would have. It was a learning experience. I moved from being very uneasy because I didn't know a whole lot. I'd never worked directly with severely mentally ill people. I just had to stay close to these people, people like Bill, the other social workers who were here, the psychiatrists who were here, ask a lot of questions. But I would say probably after about 9 to 12 months, it took you that long to really develop a grasp of what your role was here as a social worker, psychiatric social worker, is what we were called at that point.
In 1951, just 2 years after opening, the census at Brook Lane Farm increased beyond bed capacity so that it was necessary in 1952 to begin construction on a new wing of the hospital. In 1954, the construction was completed, increasing the total capacity to 38 beds. Also in 1954, the lower area of the barn was converted to a recreation area. Due to the increase in patients, the dining capacity was exceeded in the original farmhouse. In 1956, a new kitchen and dining room building was constructed. In 1957, the Mennonite Advisory Committee that had created a master plan for caring for those with mental illness made plans to organize a local board of directors for Brook Lane Farm. In 1959, Brook Lane Farm incorporated with its own local board of directors and changed its name to Brook Lane Farm Hospital. Also that year, the upper level of the barn was renovated for an auditorium and occupational therapy shop.
I was looking for a place that wasn't run by the state or the government, and that's how I got Brook Lane. I saw Brook Lane was a small psychiatric hospital at the time. At that time, they tried to disguise what was going on here, I think, because they called it Brook Lane Farm, or, and then they went to Brook Lane Farm Hospital, and then they went to Brook Lane Psychiatric Center, and then they finally they just forget that, and they went to Brook Lane Health Services, right? That's where it is now, I guess.
As the organization continued to grow, a separate administration building was constructed in 1960. In 1961, a dormitory for the women staff members and volunteers was built and called the Laurels. Due to the draft still being in effect, the staff was still mainly comprised of those who lived and worked on the farm as they completed their voluntary service. In 1962, the chapel was built and dedicated. Throughout its growth, Brook Lane continued to embrace religious principles as the core of its culture. In 1964, the Emma G. Musselman Clinic was completed. This clinic was an addition to the administration building and was built for the purpose of housing inpatient and outpatient therapist offices. Another name change came in 1965 when Brook Lane Farm Hospital officially became Brook Lane Psychiatric Center. The Fireside Lounge was added to the hospital that same year. One of the treatments used at Brook Lane Psychiatric Center during this time was psychodrama.
Doug Warner's had a big psychodrama theater up in the barn, and I got very interested in psychodrama. And so I went and I would participate in some of his sessions that he would do with his psychodrama group. It was very interesting, fascinating stuff. And so when we would have our psychodrama sessions up in the barn, we literally had a stage, a huge stage. It was very important to have the stage. And then Doug would lead these groups. People would be presented with various problems. They would present their problems. There was this woman who desperately wanted out of her marriage, and but her husband was unwilling to divorce, and so she talked about she wanted to burn the house down. So Doug had her go down to OT and build a house, build a little, like a doll house. And so then in one of the psychodrama groups, this woman took her house and took it out right up on the hill up here. And all of us were up there. And so he gave her some paper and some matches and said, "Here, you can burn this house." But she couldn't do it. She couldn't bring herself to do it. And so then we go back down to the theater and we work that through some more. And in terms of, okay, so but that's all, because he was all just obsessing about burning this house down. So where do we move from here?
The military draft ended in 1973, resulting in a reduced volunteer base, so the Laurels dormitory was converted to outpatient office space. This allowed Brook Lane to expand to meet the growing mental health needs of the surrounding community. In 1980, the west wing of the hospital was designated as an adolescent unit, and in 1984, an 8-bed geriatric wing was added to the hospital. Between 1987 and 1992, there were 3 major additions to the Laurels. In 1987, a 16-bed child and adolescent hospital was built adjacent to the Laurels. In 1989, a 6-bed children's unit was added along with a playground. These 2 additions are now the space we know as Stonebridge. In 1992, 2 wings were also added: an 8-bed adolescent unit, which now houses the Brook Lane Child and Adolescent Partial Hospitalization Program, and a waiting room and administrative space for outpatient services, which is now the main entrance and lobby area of Laurel Hall School.
So Brook Lane really, for me, was like a tremendous learning experience. I mean, I really grew up, you might say. I came here, I was 26. I looked so young. I used to I used to wrinkle my brows up to try to get wrinkles so that I would look older. And you're gonna laugh at that, but that was true.
A proud place to work. It was proud you could work here. It was very highly respected in the community. It was where people used as a first line of defense when they had a person who was seriously mentally ill. But we also had, in addition, a large outpatient population.
In 1993, an outpatient services location opened off of the main campus that today is called North Village. The Laurels was converted from an outpatient services location to Laurel Hall Special Education School in 1994. Laurel Hall is a licensed, non-public school, grades K through 12, designed to provide education and therapy for students with emotional and behavioral challenges. Brook Lane Psychiatric Center changed its name to Brook Lane Health Services to better encompass all of the various programs and services provided. In 1998, Stonebridge, a transitional care home for adolescents, opened. This licensed therapeutic program provides a home-like environment of compassion and stability for children and adolescents who are in crisis and without an appropriate place to stay. The first decade of the new millennium brought with it many new programs and services for Brook Lane. In 2004, construction was completed on a large expansion to the hospital, making single occupancy rooms available for all patients and bringing the total number of rooms to 42. This expansion also created 3 separate units for children, adolescents, and adults. In 2008, a second Laurel Hall opened in Frederick. This location also included a small suite of outpatient therapy offices. In 2010, Brook Lane launched Thrive, an autism-friendly program for children and their families focused on developing relationships and healthy coping and communication skills. Thrive began at our North Village outpatient location. Also in 2010, Brook Lane began offering an annual calendar of continuing education seminars to help area mental health professionals meet their licensure requirements. Today, that calendar consists of 12 offerings per year for roughly 1,000 attendees, a quarter of which are Brook Lane employees. In 2011, a partial hospitalization program for adults opened on the main campus, and a child and adolescent partial hospitalization program opened in Frederick. Brook Lane's outpatient office in Frederick settled into a permanent home in 2012. In 2015, construction was completed on a hospital wing for young people and a new wing for outpatient services on the main campus. A Thrive location opened in Frederick in 2017, and in 2018, in STEP, Brook Lane's integrated substance use treatment program began at the North Village location. Over the past 70 years, there have been many additions and changes to the various programs and services we provide to our community. Today, Brook Lane has more than 550 employees in 4 locations. The main campus in Hagerstown is home to a 57-bed hospital, one of only 2 private mental health inpatient facilities in the state of Maryland. We provide a partial hospitalization or day treatment program for both adults and children on the main campus and have a child and adolescent program in Frederick. Brook Lane's Laurel Hall Special Education School has 2 locations, one on the main campus and one in Frederick. We have 2 outpatient locations, North Village in Hagerstown and Buckystown Pike in Frederick. Both locations have licensed clinical staff who offer therapy for all ages, as well as the Thrive and InStep programs. Our school-based mental health program embeds Brook Lane therapists in many of the Washington and Frederick County schools, ready to provide needed therapy on site. Brook Lane also continues to be the leading provider of mental and behavioral health continuing education seminars and free community programs in this region. Brook Lane is proud to be a community partner, offering hope, healing, and recovery for our neighbors yesterday, today, and tomorrow.